Okay, we're here at the International Eosinophilic Society conference in Montpellier. We're really excited to be here. We're here with the crew for Katie, who's been a fantastic organiser of bringing a massive amount of people across the globe to come to this conference to learn about eosinophilic associated diseases. We can take you on a tour of the posters, which are going to be presented over the next couple of days, which are small abstracts of research that's gone on around the world by interested clinicians in all different specialities. You can see here, first of all, they're covering the subjects of eosinophils and the epithelium, easy for you to say, nearly as difficult as saying eosinophilic diseases. This is talking about the lining, the tissues in your lungs, your gut and your skin, and how the eosinophils move through that lining and the damage that they cause. Then you move on to mast cells and basophils. For those, obviously, there's many medics probably watching this as well. I'm not teaching you to suck eggs, but for lots of our community, they don't know about these cells. These are cells that also have a close relationship with the eosinophils and are causing additional problems in your body and other symptoms. So there's lots of research going on trying to understand what's the relationship with the eosinophil, why are they there, what are they doing when they're there. Then, of course, the all-important subject, genetics, understanding what the genetics are. Are there codes that we can find? We now know that there's no currently one specific genetic code that can diagnose these conditions. But what they're learning is when they're looking at the whole genetic makeup, there's different types of genetics that can make up different types of phenotypes within the disease. So when one person experiences one type of symptoms compared to another patient who experiences the same condition but different types of symptoms, they're called different phenotypes. And actually this can be seen when they start to break down the genetics. And there's great insights coming with this, and hopefully this will come to greater learning of understanding these diseases and better diagnosis. Next subject, understanding about eosinophils, and the subject looking at tissues and the damage and how it can be repaired. So we're thinking of tissues, you're thinking about the lining of your gut, the lining of your lungs and your skin. What happens when these eosinophils go through? They understand that the gaps between the cells in our skin is where the eosinophils get through. When they start to break down and they cause degranulation, that causes the inflammation and the damage. What happens then and how do they make it better? Next subject, eosinophils and intestinal immunity and disease. For all of our eosinophilic gastrointestinal disease patients that follow us, EOE and below the esophagus, very important. But understanding, how does that work with your immune system? Do you have other immune problems? We know some of the things that are reported about our community have lots and lots of infections and viruses. There was lots of conversation yesterday about, is having those infections and viruses, is that part of the trigger of eosinophils? They're really trying to understand this pathway. Why do the eosinophils start to come along and have too many of them in your body? We know there's no cause identified currently, but it is recognised that there is a link between your immunity. What does that mean? They're trying to understand it. No wonderful, perfect answer yet, but lots and lots of research going on. And again, looking at eosinophils and immune modulation. So thinking about patients that have got trying the therapies to reduce IgE reactions. So where they're giving you small amounts of a substance like peanut or trees to be able to reduce people who have immediate allergies. Can that be done? Does it cause more problems with the eosinophils? Those questions. And is there other ways of treating it through biologics and changing your immune system? These are all questions that they're trying to get answers to, and we're discussing here today.